Welcome to a special episode of Unbreaking Science. My name is Dr. James Lyons-Weiler, and today I'll be doing a brief review. We have an echo. A brief review of a special report and some really outstanding news. First, I want to recognize everyone that's making material sacrifices for COVID-19. I want to recognize that people are losing their jobs, losing their businesses, and I want to pay special homage to the people that are feeling isolated and distant from other people. Today, I'm going to be reporting on this measure that I came up with. I derived this measure to estimate at any given day what the effective R0 is for any country. And so far as I know, I'm the only one tracking it. IPAC is the only one tracking it. IPAC is the Institute for Pure and Applied Knowledge. And what this measure is very simple. It's the number of cases on a given day divided by the number of cases from 5 days before. So this is a ratio. And I've described this in my blog at jameslyonsweiler.com. And this ratio is derived this way because there's a 4 or 5 day asymptomatic period. And so the people that were infecting people 4 days ago, we're now seeing the onset of those cases. And, you know, it's very important, given the massive amount of disruption that's happening, societal disruption that's happening, that we have some way that the public can understand the effects of different programs, different attempts. So this measure could be done for any given state, it could be given for a city, it can be calculated for any country. And I would encourage everyone that's tracking these data and putting up these databases to calculate the effective R0 this way. The very, very good news, I'll cut right to the special report article, is that the measure shows that social distancing is working in the United States. Specifically, this ratio, this is the day since outbreak here on this axis, and this is the ratio. And we see at the beginning, since we had such small numbers, these are not the numbers of cases, but at the beginning, there was a number of small cases, and so we saw some dramatic swings here. And then we went up like this with the ratio. Every 5 days, these were updated. It was updated daily, but I've been looking at it every 5 days. And at the peak here, where it looks like above 6, approaching 6, and that's an incredible rate of spread for something that has such such an effect on the rates of hospitalization, such an effect on the rates of ICU use. And I know there's discussions on whether or not these measures are real. How can we know anything? And I'll get to that in a minute. But this is at this peak here. This is where President Trump said that the pandemic constituted a national emergency. And then it came down, and then they brought on testing. So now we see this effect of testing, this increase. Testing has been consistent, or it's consistently increasing over time, and we still see the effect of R0, the number of cases, diagnoses that are reporting, going down. Now, let's talk about this, whether this is a meaningful measure or not, because remember, this measure today is relative to just 5 days ago. And if things have changed in the United States so dramatically in 5 days that R0 itself it's now below 4. I'm sorry, it's now below 1 for the last 4 days. If things change so dramatically in 5 days with respect to testing, I would be surprised. So testing back here was non-existent, and we saw these number of cases, these diagnoses increasing. And then they brought on testing, and then there was this initial spate of increase. It's exactly what we expect. And we see it going down like this. And effective R0 is decreasing. And when as testing increases, we're going to see that the number of false positives will stay the same. That's based on the specificity of the test. We're going to see the number of people that are ruled out negatives, whether it's true negatives or false negatives, to increase. But it turns out for this measure, testing cancels out. If testing 5 days ago was about the same as testing, today, and this may level off for a while and it may be difficult, but this is a really excellent measure that we all need to pay attention to. There's a 5-day difference here. And so this is really super news. Why? Because it means that social distancing is working. I would be very depressed if this was still continuing, even though they were bringing on new testing. All right. The accuracy of the test cancels out in this measure in the long run. So we'll know in another 5 days if we're still going down, if this is going down. And right now we're at, I think, 0.5, which is fantastic. I uploaded the wrong figure here. We're not quite there. Okay, this is an old figure, so I'm going to have to update this article. But nevertheless, we're below. Right now it's at 0.55. So what I'd like to do then is say, okay, if social distancing is working and it's been going that way for 4 days, what more do we have to do? And I have certainly, we have to keep these people in mind that are absolutely making huge sacrifices. So I'd like to bring you over to another website here. This is the IPAC website. And here on the IPAC website, we see that I have published a back to work program some time ago. A week ago, I published this and I sent it to Secretary Azar. And this IPAC back to work program consists of private in-home testing where you go and you get a kit, or you're mailed a kit. It's an antibody test, and you can test everybody in the household from a single drop of blood from each person. And you can take a look at this. If there's one line, let me describe the test. Okay. Let me just go here now. I'll use this mock-up here. All right, this is a mock-up. This is a device for plugging things in, but you would put a drop of blood on one end, and then it would be a lateral flow, and so it would flow down, and then on the screen you would see one line if you're negative, or 2 or 3 lines if you're positive. That's it. It's a visual, and it's so straightforward and so simple. Almost anyone could do it. And so with the right set of instructions, some instructional videos, and the company that makes this particular test is Biomedomics, and I just found out that it is being distributed in the United States. There's a new distributor that just took that on. And so, very excited to push forward on this IPAC Back to Work program. The IPAC Back to Work program is the only liberty-conserving, rights-conserving program that I know of that's been proposed. And so you can go here and you can download the letter to Secretary Azar, and you can also view this document, the IPAC COVID-19 Back to Work program, and it outlines all the benefits and includes text from the letter to Secretary Azar. What I'm asking everybody to do is to forward this document. You can download it. You can forward the link. It's a shared link, and I'll put it in the comments of the video, to your representatives, and outline for them how important it is that we have testing that's done in the privacy of your own home. Because if we don't have testing in the privacy of our own home, we're going to end up with a serious problem. We're going to end up with people feeling that they are forced to test to be able to work, forced to test to be able to go to school, forced to test, and people don't want to be forced to test. And so what I'd like to propose is that this IPAC Back to Work program become the national model by which you are tested specifically in the privacy of your own home, and you can report the results to your doctor if you choose to. The details are on the website. Everyone's back to work if you're negative or positive without symptoms in 5 to 7 days, and it depends. Now that's radical. I understand that, but this should be discussed. What is a reasonable amount of self-quarantine if you're negative? If you're symptomatic and you have evidence of titers, basically, then you should be able to go back to work after your symptoms have resolved. It doesn't determine, the test does not determine if you have an active infection, but it will tell you if you're immune. So if you test positive for having been exposed, the presumption is that you're immune. You should be able to go back to work in a period of time. That's the idea. Otherwise, everybody's locked down. There's hundreds of millions of people that are going to be infected. Hundreds of millions of people are going to lose their jobs. There's 5.5 million people that, or 6.7 million, I think, applied for unemployment, a record amount today. And so what we can do is we can find out if you've been exposed and you don't have symptoms for a period of time, go back to work. If you've been exposed, or if you had a diagnosis and you test negative, then you can, or test positive for immunity, then you can go back to work. It's a solid plan. It fits within the libertarian perspective. Why does a government database have to be set up? The stuff that they're setting up in response to this is absolutely unnecessary. We don't need a mass surveillance. We don't need face recognition. We absolutely don't need the government to know where we are on our cell phones at 24/7, whether we're infected or not. We don't need the government to know our medical status. The census that went around, you're required by law to fill it out. I'm really, really disturbed at the level of detail that they asked on ethnicity. If that information was used by some demagogue to hurt people in certain districts, I just can't imagine why they need to know anyone's ethnicity to the extent that they're asking. So if you go to IPAknowledge.org, you can help us bring good news like this forward. Also by texting IPAK, the letters IPAK to 474747. I have a text announcement list. And believe me, we're not going to be getting away from holding on to the fact that the CDC absolutely had a testing fiasco. They absolutely sent out the wrong test at the beginning. And you can check back in the earlier episodes of this WWDNYK Studios, where I go over the fact that CDC shipped flawed tests around the United States, that medical experts, medical staff, medical physicians can't get tested, okay, and that it was just blown off. The role of false test results is there. I go over the fact that centralization of testing strategy in the CDC is a really bad strategic idea. And here's the biomedomics test details. You collect the blood serum plasma sample. You add the blood plasma serum sample, just a drop of blood, to the sample well. You add 2 to 3 drops of buffer in the sample well, and you read the results after 10 minutes. This is what the device looks like. Here's a negative. Here's an IgM positive. Here's an IgG positive. Here's an IgG positive. So one is negative. It's either 1 or 2, and you're positive. Go to biomedomics.com, talk to your legislators, look up the test, send them the website, tell them that this is what you want. And in reality, okay, it's fast, 10 to 15 minutes, and you've got your result. The reality is that, technical issues. The reality is that right now, FDA regulations prevents you from being able to know your COVID-19 immunity status. And that is nothing short of criminal. It's your body, it's your immune system, you should know. Whether your doctor knows should be up to you. It's like a pregnancy test. Not every pregnancy test is registered with the government. Here we have something that's so ubiquitous and so universal, and yet it can so profoundly impact an individual's life. And it can also impact other people's lives, other people that you work with, and people that you go to school with. And so, what we need to do is bring this infection down, the numbers of infections down in the United States to the point where at-risk populations are not getting infected. And there's a great discussion about whether or not we should quarantine them for the time being instead of all of America. Test negative, no symptoms, go back to work. For no symptoms for a long enough period of time, you're presumed to be immune. I mean, not immune. You're presumed to be not infected. There's a risk there in this test because the test is only 88% specific and it's 91% sensitive, but I have yet to see any performance evaluation measures of the CDC's test whatsoever. The FDA gave emergency use authorization to a flawed test. Think about that. And that test was shipped out all over the United States. I have yet to see sensitivity, specificity, and accuracy measures of the CDC's test that's currently in use, or the 18 other tests from the companies that have done it. If anyone knows about any such studies or any such resources available on those tests, please post them in the comments. But the Germans had a test on January 16th that they had done specificity and sensitivity testing. They had done accuracy testing. Specifically, they downloaded the sequence for the virus. They created primer probe sets to be able to amplify the mRNA through reverse transcription. And then they made mock samples of COVID-19, SARS-2 infected samples using mRNA that they created in the lab. They put that mRNA into negative sputum samples that were negative for all other viruses. So the Germans did this really well. And then they also collected sputum samples that were positive for other viruses. So they know that their test is specific to coronavirus and not other respiratory viruses. And so they actually did research. They used science to back their test. They put it out there. Hundreds of countries are using their test for the RT-PCR testing. The CDC didn't use their test. They wanted their own test, and they messed up. They screwed up royally, and that's why we have so many cases, 800,000 worldwide, 22% of which are from the United States. Think about that. Our country has 6% of the population, 4.6% of the population, 4.7. Of the Earth, of the total population of the Earth, and yet we're 22% of all the cases. We are not doing our part. Okay, we need to do better, even though the very good news is that we are doing our part. And that's what I wanted to share with you today. I won't belabor the point. I know everyone's busy. They've got a lot of things going on. I would encourage everyone to watch the High Wire this afternoon. I'm really interested to see what Dell and team does today. Really excited about the fact that they've got this alligator by the tail. Okay, I've had it by the teeth. They've got it by the tail. So I think the 1-2 punch here is awesome. If we have anything what would I like? I get questions all the time. I want to answer the following question: what is the best possible outcome that I foresee here? The best possible outcome is the number one question that I get in private message. It's what the questions boil down to. How long is this going to last? The best possible outcome that I foresee is that in the next 5 days or the next week, we see that we have no new cases in the United States. I know that sounds not feasible, but there's a reason why these hospitals that are not currently swamped with COVID-19 cases are empty. There's a reason why you don't see a lot of people there. A lot of people were laid off. They say it's due to the shutdown of elective, medical procedures, but they're sending administrators home. They're sending staff home. One of my neighbors works at a major medical facility, and he's a plumber. He's the only guy left, okay? They're sending everybody home to do social isolation. They're being furloughed, okay? And they're going to need these people back if there's a big boom, all right? But what I'm saying is social distancing is working. The medical community is afraid right now because the projections are that peak use based on the total number of cases, not based on any increase. See, another thing I want to say is they're afraid right now. It's not based on the expected increase. It's based on the total number of cases they have right now that are going to need hospitalization in 14 days. That's how this works. They're scared because they're going to run out of things. New York City, I understand, has already run out of masks, other personal protective gear. This is what I said was going to happen in January based on the projected growth of what we saw in other countries. sorry, February. I want to be sure. I jumped on this at the end of January. I don't want to exaggerate, but in February I was on this, and so that's what they're afraid of. And the reason why they expect it to come as like a surge and then peak and then go away is because social distancing is working. And this measure is a good way for you to know about it. I'm going to be plotting this out at the blog, jameslyons-weiler.com, so that everyone can track it with me. Yeah, it'll be on jameslyons-weiler.com. Again, that special report is here. And we can expect some, continued good news on this end. But the terrible news is that people are, sorry about the echo. People are getting anxious, they're getting depressed, they're getting nervous. The best possible outcome, the positive end of this, is that we have 4 or 5 days continued decrease, no new cases, and then we have to get through that surge. And you guys, it's coming. That surge is coming. And so if you're safe at home and you have a case of masks and you might need a few of them, and you can replenish them in 3 weeks, send them to your local hospital. If you live in Detroit, I would urge, this is what I said about China. When the United States didn't have any cases, I said we should be sending medical supplies to China, because the more we send there and the sooner we shut that down, the less we'll need it, the worse our surge will be. I saw this coming. I said this back in February. Now I'm saying, if you're at home and you've got a store of masks, you're not stockpiling, it's not unethical to look after your family, but take what you think that you'll need for the next 4 weeks or 5 weeks. And that should be 2 or 3 masks a week if you're just going out grocery shopping. Okay? And ship them to your doctor's office. You won't get reimbursed for them. I know people don't have a lot of money, but if you want to be part of the solution, you've got to keep your medical physicians healthy. You've got to keep your medical staff healthy. You got to keep your plumbers that work in these hospitals healthy. There is a concern of a 14-day possibility of spreading this thing by fecal route. Okay, so if you use the bathroom and you think you might be positive, you've got to sanitize the bathroom after you use it. Just make sure you do all that you can to sanitize the spaces that you touch. So that's the news for today. It's weird having to report on myself, but I'm doing the analysis. I'm doing a lot. Fingers crossed on the IPAC study showing which epitopes, if they include in the vaccines, might be unsafe. That's going through a second round of peer review right now. Keep your fingers crossed on that. Stay healthy. I've said this before, if you need anything from the community, post it on Facebook. Does anyone have X? Don't be shy. We're all in this together. Don't take and try to make opportunities for each other. I think one of the good things about this is people are going to start to think creatively about how to use this new distributed network of the internet for their own personal financial sustainability. And learn a new song, learn how to sing, learn how to play guitar, learn a new musical instrument, learn a new language. I use Duolingo. I'm learning German. Challenge yourself. Take up gardening. Gracie and I just got a free shipment of wood chips. Look up. It's called Back to Eden Gardening. It's something that's very interesting because there's a lot of work that you have to put in over the first few weeks. This will keep you manually, physically out there. You get out in the sun and you lay down construction paper like that they use to build the sides of house, and the siding of houses, stuff like that. You put down construction paper and then you put down a layer of soil on top of it. The construction paper kills the grass. And then you put down fertilizer, not mulch, but compost. Sorry, and then on top of the compost, you put your wood chips, and then you plant your vegetables and plants there. And if you have a big yard, you can really do this and make a whole food forest by planting fruit trees and things like that. Look up Back to Eden Gardening. All the things that you wanted to do that you haven't been able to get to, that taking care of projects around the house and so on. Wear a mask if you go to Home Depot. Wear a mask. I would recommend wearing masks now if you go to a grocery store. And it may be implemented that it's mandatory to do that. I don't know how you feel about that. I would say if enough of us do that and we stay socially distant, then we would be in good shape. So I'll be looking forward to talking with you all about this online. Let's try to stay positive. I put a lot of posts out there, and I get a lot of feedback about how they think that I'm not paying attention to the right thing. And I'm not being defensive about this, but I guarantee you I'm paying attention to all of it. I'm on top of the differences in flu deaths that are reported from year to year, and I'm working on an article about that and the role that might play in our understanding of COVID-19 relative to pneumonia. We're talking about double pneumonia here, and I'm not going to get into that today, but you can certainly expect to see more of that from me in the near future. So be excellent to each other, and understand that as hard as I'm working, I'm sure there are other people out there that are working twice as hard. And I'm not at risk, so far as I know. I might be at small risk, when I go out for groceries, but I'm not at risk. So, my heart goes out to people that are suffering from lost ones, suffering from job loss. This is a disaster. That's the nature of a disaster. So we're all in this together, and I encourage you to continue to do your part.